I want to start with a question, and I want you to sit with it. What if the government wanted to take your health insurance away?
What?
But they didn't want to be the ones caught holding the knife?
Thank you.
Just what if instead of voting to cut you off, they just buried your paperwork and let the paperwork do the cutting for them? No headline, no vote. And you probably wouldn't even remember, right? Just a letter in the mail you might not even open, because we have all this junk mail, comes in very generic sort of envelopes, something that we possibly can't make out, very generic, but a website that times out and a deadline you never knew existed. So what you see on your screen, ladies and gentlemen, is one of the multiple Facebook posts that I've been viewing about the new changes to Medicaid.
Come on, man.
It states that states are scrambling to get ready for a new federal requirement to double check the many people of Medicaid quality for the benefit. Now, the surfaces may seem very positive. Let's not have people who are illegally in the country. Let's not have people who are qualified with Medicaid. And this was dated August 16th, so just a couple of days ago.
Here we go again.
But it goes on to state by showing they are working, volunteering, or studying at least 80 hours per month. Politicians' focus on requiring work has angered many people with disabilities who have Medicaid and say current policies that apply to them have the opposite effect, making them choose between working or receiving benefits. So that's a whole story. You guys go to enrollees.org and you can read more about it. This may affect you, someone you love, or maybe even a family member. But nevertheless, on day one, you go to the pharmacy or you go to the clinic or the emergency room and you found out that you're not covered anymore.
Damn.
That's not hypothetical. That's happening right now, this month, to millions of Americans. And a whole lot of them look like you and I. A lot of them, whether they be Black, white, Hispanic, Asian, or otherwise, a great multitude of them, unfortunately, are Black Americans. So let me lay it out very plainly for you guys, because back in July of last year, Congress passed and the president signed the law they branded the One Big Beautiful Bill. Buried inside was a brand new rule for Medicaid, the program that covers roughly 1 in 5 Americans, the working poor, the disabled, kids, seniors in nursing homes. The new rule says that most adults between 19 and 64 who got covered through Medicaid expansion, they have to prove every single month that they worked, volunteered, or went to school for at least 80 hours. 80 hours a month, or you can lose your coverage. They call it a community engagement requirement, no less. Washington always says the prettiest names for the hardest policies, do they not? The federal deadline for states to have this machine running is January 1st of next year, 2027. And this is why I'm bringing it to you today. The gears are already turning. Under the implementation timeline, states are required to do their outreach to enrollees between the end of June and the end of August of this year. That means that this month, and a handful of states aren't even waiting for 2027, no less. Georgia has run its own version since 2023, and Arkansas and Montana switched theirs this past July.
Wake up, nigga.
So now here's the part I really need you guys to listen in on. And before we even get there, I want you guys to hear this post here from this guy out of California of these so-called Medi-Cal changes. Listen in.
And that means there's new changes for a bunch of different California programs. But today we want to give a quick overview of the changes coming to Medi-Cal. The first big change is in regards to immigrants. For all non-citizens, there are going to be some changes that go to Medi-Cal. First of all, there's going to be an enrollment freeze, and so people who are not already on Medi-Cal will be unable to apply, although people who do already have Medi-Cal will be able to keep it going. Other things that are going to be changing is co-payments and premium payments in later years, as well as the loss of dentist coverage. For more information about whether or not this will affect you or your other family members, you can go to MediHelper or other resources online to figure out whether this will apply to your immigration status. Another change that is coming next year is the addition of work requirements. For some people on Medi-Cal.
Now, before this video goes into another segment, as it kind of already did, I want you guys to pay attention for the Medi-Cal changes for non-citizen immigrants. Immigrants would like to tell us that they came over here with a nickel or dime in their pocket and they made it out the mud. And this is to any average day America. Oh, I worked hard.
I worked very hard.
Okay.
You know something most people do not. So sell it, not a PDF, a real course. Your own course platform, $22.99. Progress dashboards, certificates, quizzes from $14.99. Own it, lifetime license, self-hosted. Or you want to learn, 21 courses, $350 each. Built right, kept running. Lova.dev, 2 revision rounds, a lifetime bug warranty, the whole repository. Every price here is a starting point. Small business or veteran owned, 10% off.
Wherever they may be from, whether they're from the Caribbean, the continent of Africa, Asia, Eurasia, Eastern Europe mostly. But they come from all these different countries and they tell you that the US government, the state governments, the local governments doesn't give them or provide them resources and benefits. And yes, they do. Because why would you have changes to benefits that was never provided to people? So now you're no longer letting people sign up for healthcare insurance under Medi-Cal in California. You're no longer allowing them to have dental coverage. Again, they're losing this coverage behind these new laws. And when I tell you this, and some of you may not agree, this is good. It's not that I'm anti-immigrant, but I definitely are anti-people who are illegally in the country. If you're legally in the country, this doesn't pertain. But if you are, then you know where it flies.
Use your common sense.
They'll be required to show some amount of work, schooling, community service, or other job training programs that combined add up to 80 hours of work per month. Now, there are lots of people who are exempted from this. If you are a child or over 65 years old, or you're a parent taking care of a child, or someone who takes care of someone with disabilities, then you are exempt from the work requirement.
Let's go a little bit deeper on that, because on the surface, it sounds reasonable, right? If you're able-bodied, work for your benefits. Absolutely. A lot of good people hear that and they nod. Yep. I understand why. But look at what the data actually says happened when you flip the switch. The Congressional Budget Office projected this requirement would apply to about 18.5 million people and cause roughly 5.3 million of them to lose health care coverage. And here's the kicker, ladies and gentlemen. The nonpartisan health researchers at KFF found that most of the people who lost coverage will not lose it because they refuse to work. Most of the people who lost coverage will not lose it because they refuse to work. They lose it because of the paperwork, the reporting, the website crashes, the letter that went to an old address, the 80-hour form they didn't know they had to file by the 5th of the month. Most of the people cut off are working. They just get tangled in the bureaucracy and they fall through, essentially. This isn't a work requirement. It's a paperwork requirement, and paperwork requirements have a target, whether anybody says it out loud or not. They hit the hardest people with the least time, the least stable addresses, the jobs with the most irregular hours, the folks who can't take an afternoon off to sit on hold with a state call center. Have you guys ever called the government on any level?
That's just a terrible question. Next question.
Why is it you on hold so gosh darn long? They don't have the people.
You know what? You're so freaking obsessed.
Now, even more so than that, so many people have been laid off and cut off. So you think you couldn't reach somebody from the government then? What about now? Who actually sits in that chair when the music stops? That's the question.
The last big change that is coming is that the asset limit is going to be lowered from $130,000, which it's at right now, to $21,000 for one person or $31,000 for two people. This change is going to go into effect in July of next year. So if this is going to affect you, you have 12 months to figure out your assets and to get yourself within that limit in order to retain your Medi-Cal.
All right. I just wanted to use that as an example. I'm just using California example, but that's going to happen throughout all the states. Okay. And portion of it is positive news, because if we are eliminating, deleting, removing benefits for people who are not citizens in the country, that should provide more coverage, or we should think it provides more coverage to everyday citizens, do we not?
Yeah, sure.
But as it pertains to Black Americans, we're roughly 14 to 15% of the population. We're roughly 50 million people, even though they keep citing our numbers at 13%, and that we are roughly 45 million. Okay. But again, Black Americans are around 14 to 15% of this country, but we are about 21% of the people on Medicaid. We are overrepresented in this program, not because of some stereotype, but because of the exact history this channel talks about every week. Generations locked out of wealth, funneled into low wage work that never came with benefits, and concentrated in southern states that never expanded coverage generously in the first damn place. And now watch what these requirements are landing the hardest: the South. Because in a lot of southern states, Black adults make up an even bigger share of the Medicaid rolls than the national average. So when you build a paperwork trap and set it loose in Georgia and Mississippi and Louisiana, you are, by the math, whether it's intentional or not, pulling coverage disproportionately from Black families. The policy doesn't have to say your name to land or your doorstep, or even shout out that you are a Black American, that you are a Black American descendant of slaves, that you are a foundation of Black America. No, they know how to target. They know how to direct the energy. They know how to pull and remove coverage. So let me pull these numbers where you can feel them, because the George Washington University Public Health School, they ran a state-by-state analysis, and they found these requirements don't just cost coverage. They cost jobs and money for the whole entire state.
Damn.
Their estimate, up to 500,000 jobs threatened, and as much as $59 billion drained out of state economies in one single year. Why? I know you're going to ask that, or at least you should. Because when people lose coverage, hospitals eat the cost of uncompensated care. Clinics and local clinics close. Health workers get laid off, and the money that used to flow through these communities dries up. When your neighbor loses her Medicaid, it isn't just her problem. It's the rural hospital that was already hanging on by a thread, the one that serves your whole county. And here's a tale, by the way. Georgia already ran this experiment. Georgia's pathway to coverage program tied Medicaid to a work requirement back in 2023, and the government's own watchdog, the GAO, found Georgia spent a fortune on administration, on the bureaucracy of checking, while enrollment stayed shockingly low. They spent the money to build the maze, and most people never made it through. That's not a bug in the system.
What?
When the maze is the point, keep things confusing. How you ostracize people out of Medicaid, how you ostracize people out of Medicare. Low enrollment is the win here, ladies and gentlemen. Are we going to save the government money, or are we going to save the government the tax dollars that we pay to the government?
What kind of American are you?
Now, let me give you the full picture, because that's the deal on this particular channel. We speak in truth, fact, and metrics. The people who support these requirements, and they have real arguments, by the way. They say Medicaid was never meant to be a permanent hammock, that able-bodied adults should contribute something, and that work requirements protect the program's money for the truly needy. Some point out there are exemptions for the medically frail, for caregivers, for people with substance use or serious mental health issues and conditions, and even for folks in counties where unemployment runs high enough because of the lack of opportunities and jobs. Same reason why a lot of immigrants claim they come to America instead of building those opportunities and jobs in their own countries. I digress. That may be all true, and it's all true in a lot of regards. I'm not going to pretend that it isn't. But here's what the other side and the actual evidence says back. The exemptions only help if you can prove them. And proving them is the same paperwork trap all over again. The medically frail woman still has to document she's medically frail every month. Every month. Now, some people are like, well, yeah, she can get better. I get your point. Or the computer cuts her away. Where's the grace period?
It isn't fair.
And the deeper point is this. If the goal were really to get people working, you invest in jobs, childcare, education. I've been saying this over and over again. They want to dismantle, they want to remove the Department of Education on the federal government level that really provided oversights for the Department of Education throughout every state. And they used to fund the Department of Education. Why we are not creating educational curriculum to fill the void of the lack of talent that we have in America when it comes to IT, when it comes to software, robotics, AI, software engineering, robotic engineering, mechanical engineering, electrical engineering. Why are we not setting ourselves up for success?
That is so gross.
Here's one reason why we don't incentivize Americans to do these technological jobs that we absolutely need. It's because when you have all these big businesses that deal in these particular IT spaces that I just named, it's much cheaper to go to India. It's more cheaper to go to China. It's cheaper to go to Nepal. It's cheaper to go to all these other Asian countries because a lot of these Asian countries are empowering their citizens to learn tech, to learn coding, to learn software, to learn AI, to learn quantum computing, to learn science. Why America? We're still doing some of the same old things that we did before. And then we ostracize our own people as if we're not talented enough, that we're not educated enough. No, the curriculum has to change. You're already behind the power trap. You're already behind the power trap, meaning you're going to step in it because these things need to be implemented in middle school and high school, even before you go to college. Because when you go to these other countries, they're learning coding in high school. Some of them are learning coding in middle school or junior high school. I want you guys to think about that. So if you have the wiggle room within your finances, have your children to have and I hate to use this term because Kamala Harris used it, but a step up, meaning pay for curricular or extracurricular activity that will help them to learn how to code, some technological job. Even if they may do a trade later on in life that deals with their hands, that's fine. But we are vastly and rapidly moving into a technological age where a lot of people are going to be behind a keyboard. There's still going to be jobs that requires your hands, but why not have both? Why not be a robotics engineer and a software engineer? Why not be a plumber and someone who knows how to AI code? My thing is being multi-talented, multifaceted, multi-educational, multi-everything, where you're going to have a place in this economy regardless. You wouldn't build a reporting system that even working people will fail. But somehow the federal government continues to do that. Even though we have all these talented people here in America that can build these systems and they work damn near flawlessly. So here's the thing. When you design a rule that mostly punishes the working poor for their paperwork, you have to ask, what rule is this actually for? I believe in personal responsibility. I believe in work. Nobody who watches this channel can say that Black Logic is against people pulling their own weight. No, absolutely. This is the American way. But responsibility runs both ways. If the government is going to demand 80 hours a month of proof, then the government has a responsibility to make that proof simple, fair, and possible. Not a trapdoor dressed up as a form. And I've got a bigger warrior here. Family. This is the model. This is the blueprint. You don't have to pass an unpopular bill to cut a program anymore. You just add a monthly reporting requirement. Let the website do the dirty work, right? Let's not put people behind the problem and though the issues. Let's just put a website. Let's put a digital barrier that people just have to blame the website. But we know who's behind the website, because then they stand back and say, we didn't cut anybody. They just didn't fill out the form. That's how you take something from millions of people without even casting a vote. You have to defend. And if it works on Medicaid, it will work on food assistance, on housing, on everything. So this isn't just about health insurance. It's about a new way of governing by friction, governing by the fine print. And we better learn to see it now while it's still small. So here's your watch list. 1, check your mail in your state Medicaid portal this month, because if you or somebody you love is on Medicaid expansion, your outreach notice is going out between now and the end of this month, at the end of August. Don't let it sit. 2, watch your state's numbers. When enrollment drop, ask the question. Georgia's experience already answered this, by the way. Are people dropping because they stopped working or because they got lost in the paperwork? Number 3, watch which states apply for high unemployment. Okay, watch what states apply for unemployment, county exemptions, and which ones don't. Because that choice tells you whether your governor is trying to protect you or thin the rolls, meaning decrease the amount of people there is. And 4, watch the hospitals, especially the rural and safety net ones. If they start warning about closures, that's your early siren. So here's the biggest picture, family, that I can paint for you guys. They would tell you this is about work. It is not. It's about a darn form. It's about a deadline. It's about a website. It's about taking coverage from millions of working people. It's about taking coverage from millions of America, and 1/5 of them are Black.
Wake up, nigga.
More than that across the South, without ever having to say the words. We cut your health care out loud. Watch the paperwork. Watch the deadlines. Watch which politicians brag about protecting the program while quietly building the maze that empties it. And if you're on Medicaid, or you love somebody who is on Medicaid and they open the mail, meet that deadline. And help that person next to you meet theirs as well. Because in the new game, the ones who survive are the ones who saw the trap before they stepped in it. Drop your thoughts in the comments below. Hit that like button, subscribe to the channel, and share the video with somebody who needs to hear the truth behind Medicaid and the truth behind all the damn headlines.